Go. So don't throw the baby out with the bathwater. Imagine being dressed to the nines in your power suit, ready to give a corporate presentation. Your hair, makeup, perfect. You know your stuff. And then you feel it. That internal inferno sending you straight to hot flash hell. Despite the conference room chilly temperature, you are now visibly sweating in a room full of predominantly men. Meet Mary and her 7 dwarfs of menopause: itchy, bitchy, bloaty, crazy, sweaty, forgetful, and sleepy. She was a 52-year-old female whose last period was 1 year ago and had a higher electric bill due to hot flashes. She's a high-powered executive who sought me for hormone therapy due to quality of life issues. Her hot flashes awoke her several times during the night, and it made concentrating and remembering a daily challenge. Even if she did sleep, she dreaded presentations due to the profuse sweating that was precipitated from being nervous. And her poor husband never knew who he was coming home to because her mood swings were so common. She forgot everything, including the sex life she used to have, because all she could recall now is the pain she experienced from vaginal dryness. Worst of all, her figure was fuller now than ever. In short, she just plain felt like she was getting old. Have you ever felt this way? Aging alone is a cosmetic issue for women, but aging in this manner really affects your quality of life. Some of the top reasons people seek my help for hormones are depression, anxiety, hot flashes, insomnia, poor concentration, no sex drive, painful sex, weight gain, and the list goes on. Ladies, can you relate to any of this? We have all of these reasons to try bioidentical hormone therapy, but it doesn't outweigh the #1 reason that prevents women from seeking help: fear of breast cancer. If you had an option to feel differently, wouldn't you try it? Whether you like Oprah or not doesn't matter. Do you think one of the wealthiest women in the world, who has access to the best, most forward-thinking health care, would take something that was harmful for her? Of course not. Today I'm going to present information to you about what the media has been feeding you, contrary to what the media has been feeding you, about breast cancer and hormone therapy. I'm also going to talk to you about what they're not telling you about how to prevent breast cancer. Information that is important to your health, whether you take hormones or not, whether you are a man or a woman. This information can change how you feel about hormone therapy, improve your health, and thus your quality of life. I'm going to discuss the different types of estrogens and how they work differently in the body, and how even without taking hormone therapy, your risk of breast cancer goes up in menopause alone. Then I will define bioidentical hormone therapy, including estrogen and progesterone, and how their actions differ from what we know from the Women's Health Initiative that's commonly quoted. I will discuss to you information that supports that bioidentical hormone therapy does not increase breast cancer, and in some cases has been shown to even reduce it. Lastly, even if you choose to not take bioidentical hormone therapy, there are lifestyle and dietary interventions that can help you lower your risk of breast cancer. I will show you how you're still being exposed to estrogen from the foods you eat to the makeup and creams you put on every day. Whether you're using hormone therapy or not, these are important considerations of one's lifestyle, particularly diet, exposures to estrogen and other toxins in the environment that need to be addressed, such as understanding how the body gets rid of these toxins. And again, this is all regardless of whether you choose to take hormone therapy or not. All right, we're going to get a little meaty for a few minutes, and I promise to go slow. The body actually, we say the word estrogen, but there's really not such thing as estrogen. Oh, my thing is not on. There we go. You actually have 3 estrogens in the body: estrone, or we call E1, estradiol, E2, and estriol, E3. Estrone serves as a reservoir for estradiol. Estradiol is everything that makes you feel like a female: curvy hips, libido, breast development, I can find my next word, heart protection, bone protection, brain protection. And estriol is a rather weak estrogen that actually prevents these guys from overstimulating breast tissue and has a wonderful role that it plays in your vaginal tissue to prevent dryness, and it also helps prevent recurrent urinary tract infections, which is common when you're in menopause. We're going to refer to these again as we go over time. Estrogens are hormones. Hormones are like a key, carrying lots of information in them but that information cannot be unlocked until the key gets into the keyhole. You can have tons of hormones in your body. If your receptors don't work, it doesn't happen. That's kind of what happens with insulin resistance. You have lots of insulin often in the body, but the receptors are not responding to them. Estrogen actually has more than one type of receptor. And for simplicity, I'm going to call them good receptors and bad receptors. Good, meaning they're less stimulatory on breast tissue, and bad, meaning they're more stimulatory on breast tissue. Okay, another meaty slide, but we're going to go through it. So estrone, that first one we were talking about, actually affects the good to bad receptors in a 1 to 5, i.e. it's more bad than good. Estradiol hits the receptors equally, and estriol is actually 3 to 1 more good than bad. And depending upon whether you're menopausal or not determines how much you secreted these estrogens. Before menopause, you make very little of the bad estrogen, and that becomes your predominant estrogen once you hit menopause. So you can see that even without taking any hormone therapy, your risk of breast cancer goes up just based on the fact that you've gone through menopause. When does most breast cancer occur? During menopause. If bioidentical hormone therapy caused breast cancer, then we'd have a bunch of women walking around in their 20s with breast cancer. That's not when it typically occurs. All right, anybody got any questions so far? I know I went through a lot of stuff. We'll make it relaxed since it's a small group. The other problem that happens when you hit menopause is your progesterone drops significantly. And actually, it really starts dropping in your mid to late 30s. It's part of the issue with fertility when women try to have babies later in life. And we end up with this period where we have more estrogen than we do progesterone, which is going to be a problem, and I'll explain. Progesterone, though, is actually a natural antidepressant. It improves sex drive, it actually builds bone, it relaxes the arteries around the heart, and it acts as a natural diuretic. And yes, if you're taking hormone therapy, you need it even if you don't have a uterus. Progesterone actually has been shown to protect against cancer. How does it do it? It increases the activity of a major cancer suppressor gene, namely the p53 gene. And it decreases the activity of genes that cause cancer. We good so far? All right. So let's take a little look at a difference between bioidentical and synthetic. Bioidentical just means identical is the same, bio self. It looks like our bodies. You can't really discern the difference. So the key and the keyhole work exactly as we would expect it to work. Again, in the famous Women's Health Initiative that's quoted, there's a great difference. The women did not receive these types of hormones. Instead, the estrogen that was used was from impregnated horse urine. Let's look at what that looks like. It's the estrone lookalike. Here's Premarin, and you can see that more than 50% of the molecule looks almost identical to estrone. That's problem number one. So women were already making too much of the estrone because they were menopausal, and now they went through menopause and they start taking prescription drugs that give them more. And the progesterone that was used was not really progesterone, even though those words are used interchangeably by the media and physician. I can't stress it enough that progesterone is not progestin. They're two different things, okay? And there's a lot of problems with progestins. Progestins actually stimulate those bad receptors that I was telling you about. So the women were getting an estrogen that was less favorable, more stimulatory on bad receptors, and then they were given progestin that actually enhanced that effect. Our natural progesterone does just the opposite. It actually stimulates the good receptors. And there are a lot of problems with progestins. Clots, strokes, heart attacks. We knew all of that before they went into the trial. Why do you think birth control pills have a black box warning for heart attacks, strokes, and death? That's why. And I'm amazed at how freely they are given out to women who are above the age of 35 to increase clotting risk. One of my good friends had her friend die. She went in for a removal of a precancerous lesion in her leg. She was about 39 years old. She went back with a swollen leg. She was told it was normal, expected because she had surgery in the leg. And in fact, she ended up dying of a massive pulmonary embolism, a blood clot in her lung. My friend said, they don't know why it happened. First question I said, she on birth control pills? Yep. No surprise to me why it happened. Progesterone, our natural progesterone, kind of acts like a brake on the stimulation that estrogen gives to the breast. In fact, we have studies that show how different hormones, both bioidentical and non-bioidentical, affect breast cancer risk differently. I like to consider Dr. Agnes Fournier, a research scientist, and Dr. Khalid Mahmood forward thinkers when it comes to hormone therapy. Dr. Khalid's written books on breast cancer, and he also published something, I think in 2008 or 2009, in Oncology Reviews regarding the safety of bioidentical hormone therapy. Fournier was involved in many of the European EPIC ENOC trials. It was studying European women long-term. It's kind of like our version of the Women's Health Initiative. In 2005, her and her colleagues studied over 54,000 postmenopausal women and followed them for 6 years, average age of 53, and they'd not been on hormone therapy for at least a year. What she and her colleagues found was that using synthetic progestin, the one that I told you about, actually caused a 40% increased risk in breast cancer. Estriol alone had a 30% decreased risk. Remember in the beginning I told you this is the one that has the 3-to-1 good to bad? That's probably part of why. And in fact, in Europe, this is readily available as a drug. This estrogen does not require progesterone to be balanced with it, although I'm in favor of using progesterone. And it's marketed under the same company, Wyeth Pharmaceuticals, that makes Premarin. In our country, you can only receive estriol if you get it through a compounding pharmacy. And the FDA is attempting to block that. In 2008, they sent out nasty letters to physicians and pharmacies who were using this compound and said that it was a banned item. In their own press conference release, they later came out and said, well, we really don't have any justification to give it a ban because in order for us to ban something, there has to have been shown to have an adverse outcome. And there hasn't been an adverse outcome in estriol in over 30 years. I don't think there ever was a reported one. Why is it happening? You do the math. Pharmaceutical companies are losing lots of money when women are going to compounding pharmacies. I hate to say it, but it does come down to the almighty dollar. I always use only estriol in women who have vaginal dryness who choose not to take systemic hormone therapy. It's been shown to probably be safe in breast cancer survivors because of its protectiveness. And I don't have to worry that they might be absorbing any of that estradiol, if I'm not giving them progesterone. We're just doing it locally so she can have a sex life and not be in pain. Long and short, the typical regimen we prescribe women is a mix of estriol, estradiol, and progesterone, along with other hormones. They're bioidentical and they're from plants. Women can be looking at anywhere from no risk to a 10 to 30% reduction. 40 years trials have been published in the International Journal of Cancer. I often have women on Premarin who come to see me because they are aware of their side effects. What they're not aware of is that any estrogen, even if it's bioidentical, should not be taken by mouth. Why? When you take estrogen by mouth, you increase clotting risks, you tax your liver, you create insulin resistance, causing weight gain. You also lower your growth hormone, which is your fountain of youth, and it causes also weight gain. But there's a lot more to the story of hormones than just taking them. That brings us to the next point. And if you're not interested in taking hormones, or hormones are not a good option for you, you'll want to pay close attention. This information is important for everyone, both men and women, because the same factors that increase your risk for breast cancer increase your husband's risk for prostate cancer. We're stuck on this testosterone notion. There is no data in the literature that supports testosterone therapy causes prostate cancer. It's not there. Ask them to show it to you. So, why do we need to be worried about this even if we're not taking hormones? Because your body is still making estrogen during menopause. Yes, even if you don't have your ovaries. Where is that estrogen being made? Your adrenal glands, and more importantly, in your fat cells. Fat cells make estrone and estradiol from testosterone. In fact, how many women complain about gaining weight, or even they'll say, I'm not really gaining weight, the scale's not changing, but my body's like changing shape. Because your body is increasing fat production. It's the body's defense mechanism against the ovaries dropping their estrogen production. So regardless of whether you're taking hormone therapy or not, you're setting yourself up for uneven stimulation on the breast because you don't have any progesterone to balance it, or estriol, which is protective. It's part of the why having excess body fat increases your risk for things like breast and prostate cancer. It's also why in functional medicine, I always use progesterone whether a woman has had a hysterectomy or not. Why? She still has 2 breasts. Why would I stimulate her breasts with estrogen and not balance it with progesterone? We have receptors for these all over our bodies. That's why going through menopause is such a life-altering experience. You can't think, you can't sleep, it affects every part of your body, right down to your digestion. And we also forget about progesterone's benefits. Everybody talks about estrogen and bone loss, estrogen and bone loss. Estrogen is just preventing the bones from breaking down. Progesterone is what's building the bones back up. So you need both. I often have women who come to me at estradiol patches, and this woman in particular who comes to mind, she'd been on several patches, the dose kept being increased, and she was not getting relief from her hot flashes. I told her, all that hot flashes does not mean low estrogen. In fact, it can mean several things. It can mean an imbalance in your thyroid, or your cortisol from your adrenals, or your insulin, or, ready for this? It could be from too much estrogen. Why? There's kind of a critical mass amount of hormones. As you increase your hormones, you keep feeling better. You keep feeling better. You increase the dose, you're feeling better. Then you reach this point where you kind of fall off the cliff. And now you keep increasing it, and you don't feel good. You feel like you did before you started hormones. You know why? Because you overstimulated the receptors, and it's kind of like having that crying baby in the back of the car that you don't listen to anymore. Oh, they'll shut up when we get where we're going. It'll be fine. Your body does the same thing. Or it's because you don't have any progesterone, and they haven't been taking it because my doctor said I don't need it because I don't have a uterus. I differ. I put women on progesterone. She came back. It was a life-changing experience for her. Part of the reason the doses get pushed so high when conventional doctors are prescribing bioidentical hormones is because they're not checking levels. We take blood pressure meds, we check our blood pressure. We take cholesterol, we check our cholesterol levels. Why aren't we checking hormone levels? And the problem is, even if they are checking hormone levels, if they're giving you your estrogen the way it should be given, which is topically only, you really cannot look at blood levels. Blood levels don't tell you what's really going on at the tissue level when you're taking it topically. It's gone within 2 minutes from the bloodstream. It goes right to the tissue level. So they keep checking blood levels. They don't see a change. The woman's complaining of hot flashes. The doses get made higher and higher and higher. And she gets some relief for a while, and then the hot flashes come back. That's a classic sign that you've been given too much estrogen. Feel great 3, 4, 5 months, and then boom, you're like, God, I feel like I'm back to where I was. It's almost worse. So that's why I use saliva hormone testing. And I also look at urine. Most physicians will boo-hoo that. Why? Because they don't understand it. They don't teach you about that in medical school, and they say that it's not reliable. Really? Because NASA uses it. Even the American Endocrine Society has stated that saliva hormone testing is a good option for looking at things like cortisol function. Again, we're only halfway through the story, because the estrogens that your body still makes in menopause need to be removed from the body. It's not just the estrogens either. It's in medications, it's in toxins you come into contact every day in the environment, and general waste that the body makes. The body wants to remove this waste by a 3-step process called detoxification. So we're going to break this idea down, but I want to pause here because I know I'm giving you a lot of information. Questions? I don't see too many glazed looks. Everyone seems to be following me. Yes?
I have a question.
Sure.
I started out probably 12 years ago with the synthetic.
Mm-hmm.
Okay. I went to Bioidenticals, but I'm taking them orally. And I tested for it, the combination of estrogen and progesterone by blood, obviously.
Right.
So now I'm
I'm rocking your world, huh?
Well, I'm really far, you keep saying about menopause, but I'm way past menopause.
Yeah.
I'm 65, so.
But you look young. Why do you think you look so good?
Because I'm taking.
Yeah.
Absolutely. So.
But the estrogen should not be by mouth.
It shouldn't be. Yeah, I took the progesterone cream, but you know, the compounds were just so much more expensive, quite honestly.
Well, there's a couple ways around that. First of all, the progesterone can be given orally or by mouth. Estradiol patch is actually bioidentical, and I do use those in women. The problem is I can't make it dose specific, and you need to at least take the estriol, because you're not getting any estriol if you just do an estradiol patch. So there's other ways to do that, and you can make it affordable. I mean, when it's all combined, it's very cost effective. But in that instance, I would probably try to use, what are you using, Prometrium as your progesterone?
It just says progesterone on the.
You fill it like CVS or whatever?
Yes.
Yeah, so it's Prometrium, which is bioidentical progesterone. The problem is it's in peanut oil, which is very allergenic. And the other problem is it's very short acting. It's 4 to 6 hours, it's out of your system. When I compound it, I make a sustained release formula. And as long as you've got good GI function, if I'm going to give it orally, you get more sustained coverage. So.
I usually take the progesterone at night only because.
Probably helps you sleep.
It helps me sleep.
Yep. Yep. Yeah.
What about testosterone?
What about testosterone is important. I know, I just couldn't even like limit it.
Test for
Oh,
11 years.
yeah. Okay, so that's the wrong form of estrogen and testosterone to take because it's synthetic and it goes to the liver and it's very toxic to the liver. But yes, testosterone is something else I do test for. I just felt like I had so much stuff to talk to you guys about. But yes, testosterone is definitely an issue. It's particularly an issue if women have their ovaries removed. But if you're far out from menopause, there's also often an issue with testosterone deficiency, and it really can make a big difference in how women feel.
So at 30 years old, I had my ovaries removed. So
Right.
the testosterone.
You
was-
probably have very low testosterone.
So that was why they had me on it. But it's not a dangerous thing.
No, it's, oh no, testosterone I use all the time, but it should be topical. Testosterone should not be taken by mouth at all. And Estrotest, I believe, is off the market now. Yeah.
Thus, I'm here seeing you.
Thank you.
Going, oh my God, what am I going to do now?
Yes.
Did you say you don't like the patches?
I do. The patches are bioidentical. It's estradiol, the Vivel dots, the gels. The problem is, particularly the gels, they're very high dose, a lot of them, and it's hard for me to customize the dose that I want to give you. Like if I feel like you're too high and I want to cut you back, it's like, well, do a 1/3 of a squirt, and it's kind of hard. Patches I can play with a little bit more, but it's a little bit more restricted. But we got to work. We shoot for optimal. We go for the best. That's the way I look at it.
So what do you like for topical?
I use topical for estrogens and testosterone only.
Is it a cream or?
It's a cream or a patch if I use a Vivel dot or a Minivel or those sorts of things.
Are bioidenticals compounded? I'm assuming they're not covered by insurance.
Typically not. What I've found is, it depends though. The catcher is the insurance companies follow Medicare's lead. And because of estriol being a banned FDA substance, if I put estriol in the cream, they don't want to cover it. And they don't want to cover DHEA because it's over the counter, and it shouldn't be over the counter. I do work with a local pharmacy here. They don't take as many insurances, but I work with Meyer Lee, and also one of my professors has a pharmacy in Michigan, excellent quality, and she takes a lot of insurance. So I try to do the hormones through them, and if I have to, I just compound out the estriol separately. A lot of times the estriol you don't need to use every day. I can give you a good enough dose that you can do it like twice a week, especially vaginally, so it keeps the cost down a lot. That's how I try to attack it. I know it's not, all this stuff gets expensive, it is, and that's why what we're gonna talk about now is gonna be about what are you gonna do, whether if you're not on hormones or you are on hormones, and how you're gonna keep yourself healthy. Okay, we good? All right. So, this is how I discuss detoxification, because trust me, it's complicated even for me. So, there's 3 phases, and I want you to think about your dirty laundry that's piling up at home. Okay? Here's your dirty laundry right here. All those dirty underwear, socks, all that stuff. You know they're dirty, they stink. You got to get them into the wash. That's phase one. It's first phase. What is it doing? Really, it's literally adding water to all these compounds that we're trying to get rid of. Then, what happens if you leave those clothes in the washing machine and you don't take them out? They stink. They stink bad. They stink worse than they did before they went in. These are these intermediate metabolites or reactive metabolites that can go on to cause tissue damage. Okay? It's where things like antioxidants can help block. But these intermediate metabolites, we got to get them into the dryer. Okay? Got to get the clothes dry. Now you got the clothes dry, and what happens if you let them sit in the dryer for too long? They wrinkle. I have an ongoing 10-plus year argument with my husband to not let the clothes sit in the dryer. So we have to get them out and fold them. Well, that is your excretion. We excrete in our serum, our kidney, our urine, our bile, and of course, our feces. If you don't have a properly functioning gastrointestinal tract, or even if it may function, you may go regularly, 2 times a day, by the way, is what's regular, not once or whatever's normal for you. Literally, the bad bacteria take your nice, neatly folded clothes that you've just getting ready to put away and pull you right back over to here. And the reason these metabolites are causing tissue damage is because they're stimulating those bad estrogen receptors that I was just talking to you about. All right, we still good? We're going to talk now a little bit how it relates to estrogen metabolism. We're getting through the meaty stuff, though. That's the good news. Okay, here they're dirty. They're all done being used. Estradiol and estrone go back and forth. Your body wants to get it out. It sends it into the wash. These are all the different detergents that got used. And we have all these intermediates that are pro-carcinogenic, cause cancer, cause cancer. This one goes down and is probably one of the worst ones. And if you don't neutralize it and get it into that dryer, this goes down directly to mutate your DNA and affect cancer risk. We actually measure these metabolites in women. We can measure them. And in fact, many women have problems in how their dryer system's working. This is a gene here. And if you don't have a properly functioning gene, you end up with all these intermediate guys. Remember George Burns? He lived to be like 97, smoked cigars, drank liquor, did all that stuff. You know why he did that? He donated his body to science, and they found out after he died that he had not 1, not 2, but 3 pathways to detoxify from. Most of us don't have a full functioning one. We call that a gene SNP. It means there's one little bleep in what your enzyme looks like and my enzyme looks like, and it either works to your advantage, which is what happened to him, or it works to your disadvantage. So particularly breast cancer survivors, I want to know, does this gene work, does this enzyme work very well? And if it doesn't, what am I going to do to push it to make it work as best as I can? Those are instances where you're taking a lot of B vitamins and you're doing what we call giving methyl groups. Those are the little parts that help dry your clothes, like the dryer sheets, the organic ones, of course. Okay, and remember, I told you that if you don't get it out over here, if you get it all the way to here, but you can't get it out of the body, you go right back here. You go right back here, and you go right back here. And those are all your cancer-causing guys. Each step of detoxification requires key ingredients from food supplements to work. Let's flash back for a second and look. And you can see some of these metabolites that we're looking at. One of the first things that you need is adequate protein. You need adequate protein in the diet because protein provides the amino acids for both phases to actually get these things out of your body, particularly the dryer phase. And I know, I say protein, you think animal protein. But vegetable protein is actually better because it's less acidic to the body. And contrary to what was stated before, lemons may be acidic outside the body, but when you take lemons in the body, it actually is extremely alkalizing. Lower acidity also makes it harder for cancer cells to live and infection. Vegetables offer protein that's ready to use. It gives you the amino acids. Your body doesn't have to break it down. It says, here's your amino acids. Do what you need to do to detoxify. It also contains a lot of a compound called calcium D-glucarate. It's a big word, but it's part of what prevents your bad bacteria from sending you back and getting your nice, clean, folded clothes wet again. It's very important. It's actually been shown to reduce breast cancer risk anywhere from 30 to 70%, depending upon the study. So what are some good sources of vegetarian proteins? Beans, legumes, nuts. And the good news is they also provide a lot of B vitamins. I generally have people on B vitamins even when they take a good diet because stress, caffeine, sugar, medications, alcohol, they all deplete your B vitamins. Prilosec is a big culprit of that. Ground flaxseed is important. I mentioned this ground flax instead of the oil because this contains lignans, which also help with that estrogen detoxification I was talking to you about. Organic green tea, antioxidants like pomegranate, beets, curcumin, and my favorite group over here, your cruciferous vegetables. Broccoli in this group, but broccoli is the highest, has a compound in it called glucosinolates. It was actually isolated by Johns Hopkins University, and it was patented in the broccoli sprouts because really, in order to get enough of it, you'd be eating 10 cups of broccoli a day, which is good, but not everyone will do it. And that's why I tell people, this is where you have to lay the foundation down, and if you can take the supplements, there are some basic things that I think are important to be on, especially when you're on hormone therapy, and even if you're not on hormone therapy. Remember, we still have to detoxify those estrogens. So vitamin D is important. And yes, most of my patients are vitamin D deficient in Florida. Why? Because we bathe in sunscreen. And a lot of that sunscreen we're going to talk about later may not be as good as we think. We need to pick the right types of sunscreen to protect us. B vitamins from high-quality nutraceuticals, probiotics, magnesium, fish oil. And this is one of the vegan proteins that I use that actually carries that glucosinolate inside of it. As we said, a lot of women are afraid of taking estrogens because of the risk of breast cancer. What they don't realize is they're exposed to estrogen every day, from the food they eat to the makeup and the sunscreen they apply. They're called xenoestrogens. Xeno for being outside the body. And they look close enough to estrogen that they actually stimulate the receptors and they start sending unintended signals. The big word for that is called neuroendocrine disruptors. Basically, it's messing with Mother Nature. That's the easiest way of saying it. I warned you about the hormones and all that meat and dairy you eat. One of our biggest exposures from hormones is from our food. Do you know what's in your meat? Listed there, estradiol, testosterone, progesterone, growth hormone. We are using more hormones now than ever. This chicken is 3 weeks younger than this chicken. That's 1950. This is 2008. You think we're not getting that in our bodies? We are. We have girls developing breasts at 8 years old. Where do you think it's coming from? And it's not just our livestock. It's our produce. Do you also eat these with that mask on? It's one of the reasons we have to use so many pesticides is because of genetically modified food. The talk is not going to allow a lengthy discussion, but I have to spend a few minutes on it because it's a big problem in xenoestrogen exposure. You can't hide from GMOs either. 70% of your supermarket food contains GMOs. Why do we have GMOs? A company called Monsanto developed them, and they were supposed to be the cure for world poverty. Last time I checked, people are still starving out there. And they were supposed to be drought resistant and insect resistant. So they weren't supposed to need many insecticides. But guess what? Those crops actually are more resistant to insecticides, and they had to create a special insecticide called glyphosate, known as Roundup, readily available at your local Home Depot. And guess who makes Roundup? Monsanto. Our government is allowing this. Ironically, on the one hand, Monsanto says it's so unique, we have to patent it. They're literally suing farmers, little family-owned businesses, because their genetically modified seeds end up in their crops even though they didn't buy those seeds. Okay? But on the other hand, they say, oh, they're really the same. We don't have to label them. You don't need to know what's in your food. You can't have it both ways. Why is it happening? Because everybody's pointing the finger at everybody else, and who's supposed to make sure these things are safe? The EPA has had decades of Monsanto poisoning. They know about it. Is it the Environmental Deception Agency, or is it really our protection? I really question the more I learn. Okay. Remember, it's not just your food. It's also your non-stick cookware. And no, I don't care if it says it's Teflon free. If it says the word non-stick and it's not stainless steel or cast iron, it's got xenoestrogens in it. Plasticware, cleaners, laundry detergent, all these beep cans and milk cartons. I actually recently learned that the BPA-free liners, and I haven't done the research on it yet, may actually be equally as bad. It doesn't really surprise me. And even our water, our tap water, water we get from the bottle, and my all-time favorite, skincare. This is a huge exposure. God always works in mysterious ways. He put me right next to organic spa because it's very important to be using skincare products that are organic. And contrary, it is worth the money. You're literally applying things that are messing with your body's estrogens. It's very important. How do you know what's in them? Most of the time you don't. You know why? Because they have substances in them called GRAS, or generally regarded as safe by our FDA. And guess what? They aren't tested very much. They're not tested the way food and drugs are. And they're in all of our stuff. Here we go right here. Here's all the fillers. And you'll find it pretty much, and pick up any cream that you get in the store at the pharmacy. That's what you're going to have inside of it. Okay? And so how do you know what to do? I think you all's got the little goodie bag in there. I have in my marketing sheet, there's a group called EWG. It stands for Environmental Working Group. It's a nonprofit information, and it's very good at telling you what are safe skincare products, what are safe sunscreens. Other hormones that affect breast cancer include melatonin and adequate thyroid function. I wrote the TSH has failed us because it has. That's not the most sensitive thing to look at thyroid function. In fact, T3 is one of the most important things to be looking at. And I don't know many physicians who check it, and the ones who do check a total, not a free, and it's very important to know your full thyroid function. That's a whole talk in itself. And the other things that affect breast cancer risk are high insulin levels. Again, even if you don't have diabetes. Why? Because insulin is a growth hormone. In the end, Mary was given the information about the risks and benefits of hormones. She worked with my health coach. She got on the right diet plan. She was feeling better, but it wasn't enough. She opted to try the bioidentical hormones. In about 3 months, she was feeling like herself. I ran into her brunch recently, and she really touched me when she introduced me to her husband as the, quote, doctor who changed our lives. In closing, if you're considering bioidentical hormone therapy for any reason but are only being held back for the fear of breast cancer, you have options you didn't realize. This therapy is totally different from what was used in the Women's Health Initiative, showing an increased risk of breast cancer, and there are other trials showing its safety. There are ways to prescribe hormones safely, including the forms and the delivery routes, as well as ways to monitor levels and looking at those breakdown products to make sure your body's getting rid of them. Remember, these are for whether you're taking the hormones or not. Regardless of whether you opt out or take hormones, your risk of breast cancer still goes up with menopause. And by balancing hormones, starting with nutrition and considering hormones, it can potentially reduce your risk. With or without, women need to be aware of these things to keep themselves healthy. And of course, we need to always come back to these things, not smoking. By the way, 10 grams of alcohol a day can increase women's breast cancer risk significantly, and a glass of wine is about 11 grams. It's a big problem here in Florida. Everybody drinks. It's very socially acceptable, and I'm just going to tell you that a glass of wine every day is too much. Am I telling you not to drink? Hell no. I drink my red wine. I get organic wine, and I probably drink about 2 glasses a week. Lots of veggies in your diet. You got to exercise, watch the weight, and God, get some sleep. And of course, find balance in your life with everything. It'll actually say on there, Belafonte is one of the ones, and Fryer, I think it's Freyer, makes some organic wines. I'll tell you what, you get less of a headache too.
Less sulfate.
Yeah, you really do. And you know what else? If you can't get an organic wine, you're out. I look for wines that are like made in Italy or France. Like they have very strict rules about pesticides and sulfites, all that stuff. Or even like a Washington State wine, I find I don't get the headache as much.
Yeah.
So there's something to it. You can get them at Whole Foods, and you can get them at Food and Thought. Yeah, I mean, and a lot of restaurants now are offering them more. This is my goal, is to get the information out there. There's a lot you can do even without seeing me to keep yourself healthy. The problem is we're being brainwashed by the media. All right, I'll get off my soapbox. Oh, also, I'm offering for those of you who attended my conference here, since you had a choice. The other ones you didn't have choices. My children are passing around a $100 off coupon for a new patient consult if you've never seen me before. Go ahead, girls.
You want to take a couple more questions?
Oh yeah, we got a few minutes. I guess Sharon, if anybody has any other questions, I mean, we could shoot it. I mean, anything. Nothing's off limit.
Well, I've been taking the estradiol orally, so is that bad?
Yes. It's bad. Bad. Take it. Needs to be taken topically. Switch to a patch. Switch to a patch. But try a patch. I mean, I'll take a look. And by the way, that's the other problem, is a lot of physicians do prescribe bioidentical hormones topically, and they're doing them at the doses that they would be taking them orally, and you take much, much less when you take your hormones topically because they're not going through your liver. In fact, part of the reason our master's program was even started, one of my mentors, Pam Smith, she was visiting a compounding pharmacy, and a script came in for topical progesterone, 100 milligrams, and she almost fell over. She's like, there needs to be standardization. People need to get educated. That's not the dose that you use of topical progesterone. It's way too high. Yes, you had a question over there.
Do you accept Blue Cross Blue Shield?
No. I know that gets people upset. I can't take insurance. They don't give me time to do this kind of stuff. We do submit for you. I mean, we give you the form so that you can just submit it in, and it really depends on your out-of-network benefits about what they cover. The good news is we can do a lot of testing with your insurance, so that saves, I mean, I have to test for hormone levels because I'm not going to just do it to do it. But I just, when people are limited, I do the testing that we need to do, and sometimes we can't do everything we want to do. So we make the best of it with lifestyle. We don't live in a perfect world.
How about Medicare?
Medicare, we submit for Medicare. You pay up front for Medicare. I'm considered non-par, and so they will reimburse you directly. And actually, on my intake sheet, there's a number that I think it's 790-7442. You could speak with my office manager, who's the bald guy over here, and that's what he does. I don't even try to understand all of that, but he really knows how it works. And the biggest upfront fees are usually the initial consultation and physicals in terms of what Medicare considers covered services. The $100 off will help a lot, though.
Males, you take males?
Oh, absolutely. Yeah. What usually happens is the women get their hormones, and they're like, I got to get my husband in here. He's just sitting on the couch, slumping away. Yeah. Yes?
Just to verify, estradiol, you need estriol also.
You should take estriol also, and estradiol, and it is bioidentical what you're taking, but the estradiol should be taken topically.
Another question. I use a makeup that has no metals in it as well as anything, and I'm like nuts about the GMOs and all that kind of stuff. I have a friend who Facebooks all this stuff. So my question to you is, the dermatologist, I think it was, talked about chelation and the metals in our bodies and so forth. Do you also think that, and I know one of my this friend had that, the metals
Yep,
removed
metals are
from the body?
definitely a part of an issue.
They are.
Absolutely, and you can go to that ewg.org website and look up your product that you believe is so good. I've been surprised by some of the things I've taken.
Yeah.
Okay, I'm gonna take one more and then we're gonna go because we're coming back.
If you're already on Develbot, what else do you need to supplement?
Progesterone and estriol. 5L's estradiol. But estriol you could use twice a week vaginally. If we had to, we could use prometrium. So there's ways around it. Yeah, we make it work.
Thank you.
Thank you.